A big announcement today in Marin County. Officials there say that they have seen a drop in the number of chronically homeless people. The finding is just part of the most recent homeless count. To discuss the programs and overall approach to treating homelessness in the county, I'm joined by Ashley Hart Mcintyre, homeless policy analyst with Marin County's Department of Health and Human Services. Thank you so much for joining us. First of all, let's talk overall about homelessness in the county. What did this latest count reveal?
Thank you so much for having me. This latest count revealed that we have reduced our chronic homelessness in Marin County by 28% since our last count in January of 2017.
So what are those numbers? You mentioned 28% drop. What are you looking at now?
We're looking at 257 people experiencing chronic homelessness in Marin County. And that sounds like a relatively small number, especially when you're comparing us to communities like San Francisco or Oakland. But don't forget, Marin is actually a relatively small community overall. We only have about 250,000 people here. And the percentage of people experiencing chronic homelessness in Marin as a percentage of the overall homeless population has historically been pretty high. So this reduction is a big deal for us.
Is this the first time you are, in fact, seeing the numbers drop a bit?
Our methodology changed in 2015, so it's a little bit difficult to compare numbers over an extended period of time. But in 2017, we did see a small drop in overall homelessness, but an increase in chronic homelessness.
Okay.
So a 28% reduction in chronic homelessness is big news.
It certainly is. So why do you think this is happening?
We really credit it to the many systemic changes we've made over the past several years, really focusing our system on ending chronic homelessness. And focusing on implementing the housing first approach. We have really shifted our programs so that we are placing people on housing first and then surrounding them with the services that they need to stay housed. And that's an evidence-based approach that has 30 years worth of studies backing it up. And it's one that's in use in many communities across the country. We've also increased the number of permanent supportive housing beds that we have available for this population. And we've improved communication and data sharing across all of our agencies so that we can really meet each individual client's needs.
Well, as the numbers show, it apparently is working there. We don't have a whole lot of time left, but tell me a little bit about what you're planning to do now. Or will your strategies change a bit given these latest numbers?
This has really emphasized to us that we are on the right track. So we'll keep going with what we have been doing so far. We know that we need more housing. We need more permanent supportive housing for people. And so our efforts will redouble to continue to increase that number.
All right. Thank you so much for talking with us again. Marin County seeing a decline in the number of chronically homeless people there. Thank you.